Hey everyone, we're back at TJ's Tuesday Tidbits, coming with you with infantile colic, right? Probably one of the biggest things that affects babies is colic. But what is colic? Well, colic is one of those things where they just get stomach pain, stomach cramping, distended bellies. You might start seeing the reflux going on, those types of things with colic, okay? Well, what causes colic? A lot of things can cause colic. Stress can cause colic, right? Dysbiosis, in which they don't have properly flourishing bacteria in the gut, can cause colic. Formula, those types of things are big issues with causing colic. Breast milk can cause colic when the mom is consuming things that are irritable to the baby. Okay, maybe the baby is sensitive to certain things because their gut hasn't fully formed yet, and the mom starts eating certain foods, and then the baby starts reacting to those things. That can cause colic. Same thing with the reflux that can occur. So what do? Well, you can take them into a pediatric trained chiropractor, okay? Not all chiropractors are fantastic with babies, and you need to do your research and figure out which ones you want to go. If you have word of mouth referral, that's fantastic. You can go to the ICPA, okay? I think it's icpa.com or .org. That's the International Chiropractic Pediatric Association. Their docs are listed on there for who had received pediatric certifications for adjusting babies. Okay, can babies get adjusted? Yes. I have three daughters. They've all been adjusted within an hour of being born. Okay, we don't do the pops and cracks when they're little like that. Just nice, easy pressure with some vibration, mobilizations, things like that, and they respond beautifully. Have any of my daughters ever had colic? No, because we keep track of what they eat. We try to do things healthy, and we keep down the inflammatory responses, and then they don't get colic, okay? So, what can you do at home that's going to help you out the most, all right? One, you can go and find a very good pediatric probiotic, okay? We carry them in our office, or you can go to your health food center and research which ones they have and which ones might be good for babies, okay? And start delivering that into their system every day. That can help out a lot. You can go with the more natural-based formula. There's lots of recipes online if you're doing formula, and find natural-based formulas that aren't going to have as much irritants in it as some of the formulas that you might find at your grocery store or Walmart or things like that. You can do belly rubs, and we do belly rubs. We're starting in this quadrant. We're doing clockwise motions up the ascending colon, across the transverse colon, and down the descending colon. Now, I typically won't do that unless you could get into a trained chiropractor who can show you how to do those things, because you don't want to use too much pressure and cause a lot of pain. You don't want to use not enough pressure and not getting results. So before you try those things, you should bring your baby into the chiropractor. Bicycling the legs, that can be very helpful in getting movement. Now, colic, you always have to be aware, is the baby constipated, or is there diarrhea, or is there constipation followed by diarrhea? If your medical doctor tells you that the baby hasn't pooped in 5 days and that's normal, he is wrong, okay? That is not normal. Your baby needs to poop every day. That's normal, okay? So you need to make sure that that's occurring. If it's not, you need to start on the probiotics and go see a pediatric trained chiropractor and get things moving, okay? One other thing that you might find with the colic, like we said before, is the reflux. Reflux is not a normal occurrence, and you don't have to worry about the baby absorbing things nutritionally as long as the baby is gaining weight and peeing and pooping every day. If that's occurring, I am not typically concerned about the reflux. Having reflux, especially after being bottle fed, is entirely normal, because sometimes they're getting too much. As long as they're gaining weight, pooping and peeing, okay? If they're not gaining weight, or they're not peeing as much, or not pooping as much, then you need to be concerned, all right? Then you need to go see your pediatrician or your pediatric trained chiropractor and go from there. Now, in our office, we are trained in pediatrics. We took certification courses. I am no longer on the ICPA website. I'll be the first to tell you that, but we treat a lot of babies here, okay? So if you have any questions with that, you let us know. Now, also, Dr. Sarah Graber, my wife, over at Edgerton Family Chiropractic, specializes in women's health and babies. So if you have any questions whatsoever, feel free to give her a call. She's at Edgerton Family Chiropractic. Their number is 507-631-7565. Their information is on my website at foldafamilychiro.com. My number is 507-425-0025. We do lots of things with babies. They do lots of things with babies. If you have any questions whatsoever, and if your baby has any colic, get them in to see us, all right? Now next week we're going to kind of continue this pediatric training. We're going to start talking about some ear infections and some more about some adjusting babies, all right? Hope you guys have a great week. Hope that information is useful to you, and we'll see you next week.